So how would you like how could the state and the, on the federal level, how could they cooperate more to make this happen?
Well, we have an example in front of us, and that's Kevin's Community Center. If you can generate similar clinics in different towns following a similar model, then obviously that will help to cut the number of those uninsured and provide more services. And this will also involve the whole community in actually finding an answer to this problem by having volunteers and by having people donating money and donating resources and donating their skills and time in helping those who are uninsured.
Now, how I know that there's a way that the insurance companies could sort of ease up a little bit on the situation to enable, let's say, a retired doctor to come in and give hours without having to carry a full
yes,
and
and that's actually very important, and that has to change somehow, because in a clinic like Kevin's Community Center, a semi-retired or a retired physician who likes to actually come to the clinic and volunteer his or her skills and time, for them it's impossible to do it now because they have to have their own professional liability insurance. And needless to say that the cost of purchasing such a policy is prohibitive even to physicians.
Sure, and all they want to do is come out and help a couple of hours a month. If somehow they would cover you as an entity.
Some of the states circumvented this problem by doing by having different ways of dealing with it. Unfortunately, Connecticut is not one of them, at least not yet.
Okay. Now, ladies and gentlemen, if you if your pen is in the kitchen or you don't have one, go get one, because this is important information. If you know anybody that is uninsured that needs medical care, I want you to take down this number. It will be on the bottom of your screen. If you could tell the listening audience, please,
Sure.
where it's located, the number. Also, doctors, we need you to come out and give your time. This is a good cause, and we trust that you're going to do the right thing. So,
well, thank you again. And the clinic is located at at Fairfield Hills. Signs can lead you to the center. We are in need of medical and non-medical volunteers, and we can always use more volunteers to make it more efficient and more productive. We also need, of course, physicians that can volunteer their time in making this, again, not only to benefit Kevin's Community Center and Newtown in particular, but also to make it a possibility for other communities to have similar clinics and similar programs.
And you're willing to help other people if you get calls?
Absolutely. Absolutely.
Because you've been through it.
That's exactly the idea. And of course, it's a process and it's a learning curve. And hopefully, if the state makes it a little bit easier for nonprofit clinic to spring up, then more will be involved. And just talking to physicians and volunteers, they're all eager to help. They just don't know how, and they are at least the providers, the physicians, are scared of liability issues. And if this is eased up a little bit,
sure.
it makes the process much more efficient and much more productive and meaningful.
Beautiful.
And the phone number is probably on your screen. It's area code 203-426-0496.
Say one more time.
And again, 426-0496. You can call anytime, and somebody will get back to you, usually within 12 hours. And if you like to come and visit us at the center, we are open every Wednesday from 1 to 5. This is when the clinic is actually open to see patients, but we do have a very active advisory board committee with 20 members, and we are open to new members who have the commitment and the time to make it, again, the worthy cause it is.
You're a good man, Dr. Michael Taweh.
Thank you very much.
God bless you.
Thank you.
All the best to you.
Thank you. Thank you.
The next two selections are Haida and Vine and Fig Tree.